Good morning. My name is Jarushka Naidoo, and thank you for the opportunity to answer your questions on this November Lung Cancer Awareness Month. So the first question, what are the signs or symptoms of lung cancer? The most common symptoms of lung cancer include cough, shortness of breath, weight loss, coughing up of blood, or chest pain. If you experience any of these symptoms, it is important to reach out to your general practitioner, or if they are emergent or severe, come to the accident and emergency department. The second question, is lung cancer hereditary? So far as we know, lung cancer does not appear to be hereditary. However, we do know that in about 80% to 85% of patients with lung cancer, it is related to prior exposures in their lives. Smoking exposure, exposures to other harmful substances such as asbestos, and in about 15% of patients, smoking happens in those who never smoked in their lives. So I think one of the most important take-home messages is that anyone with lungs can get lung cancer. The third question, does lung cancer show up in an X-ray or blood work? So the answer is that lung cancer can show up on an X-ray, but usually it will only show up on an X-ray if it is of a certain fairly large size. Low-dose CT scans of the lungs are often more sensitive and specific for picking up lung cancer rather than chest X-rays. This is one of the reasons why certain countries in the world have lung health checks that incorporate an early detection mechanism of a low-dose CT scan, because this is more likely to pick up lung cancer. And we know that X-rays may sometimes miss the presence of lung cancer. Lung cancer is not detectable in blood work. In fact, there are very few cancers that can be detected in the blood work. Sometimes patients may have certain blood tests to track the activity of certain treatments while they are actively on cancer treatment. However, lung cancer is not one of these cancers. The next question, can lung cancer be detected early? The answer is yes. Two large and important clinical trials called the Nelson trial and the NLST trial aimed to answer this question. And what these two studies showed was that patients between the ages of 50 to 80 in one and 55 to 75 in another who had smoked a certain amount in their lives, which is defined as a term called pack years, are risk factors for the development of lung cancer. And in those patients, if they are funneled through a program for early detection, which usually involves a comprehensive all-over lung health check, including a system to stop smoking and a low-dose CT scan of the chest to pick up lung cancer early, that this may indeed pick up earlier stage lung cancers and result in a survival benefit for patients. So this is something that is now being investigated in different parts of Europe for its potential role in picking up lung cancer. The next question, what is the treatment for lung cancer? So this is a very large question. And I think broadly how I explain this is it depends on two things. It depends on the stage of the lung cancer. Stage means where in your body is lung cancer located. And the second is the biology of the cancer, meaning what does the lung cancer look like on a biopsy? So in terms of stage, there are 4 stages. Stage 1 means a lung cancer that is just located in the lung and of a certain size. Stage 2 means a lung cancer that is located in the lung and involving a nearby lymph node in the chest. The third stage of lung cancer involves a location of a lung cancer tumor in the lung, as well as some lymph nodes in the middle of the chest. And lastly, stage 4 lung cancer means lung cancer that started in the lung but spread elsewhere in the body, which can mean to the other side of the lung or more distantly to common areas such as the brain, the bones, and the liver. The treatment of lung cancer depends on the stage. In earlier stages of lung cancer, stages 1 and 2, usually the main treatment is surgery, and in stage 1, it can be a form of high-dose radiation. We sometimes give chemotherapy around the time of the surgery, either before and after, to reduce the risk of the cancer coming back. Stage 3 lung cancer is very complicated, but may involve any combination of chemotherapy, radiation therapy, and or surgery, and in some cases may involve immunotherapy for a year afterwards. In patients with advanced lung cancer, the treatment choice directly depends on the results of a biopsy sample, in which we test for two main markers: a marker that tells us whether a patient's lung cancer will respond to immunotherapy, a new type of treatment that uses the immune system to fight cancer, and a separate set of markers that is more commonly found in patients who may not have smoked in their lives, in which we may be able to give what's called targeted therapies, which are mostly tablet treatments that aim to shrink the cancer based on its genomic features, so the genes related to the tumor, not the genes we were born with. So really the treatment landscape of lung cancer has become far more complicated. In one way, it's very exciting. We now have many new treatment options for patients with lung cancer. The next question, how does lung cancer treatment affect everyday life? I think this very much depends on the treatment in question. For some treatments, it can mean that patients may be tired or have side effects around the time of their treatment. For other treatments that may be lifelong, like chemotherapy or immunotherapy, or even some of these newer tablet-targeted therapies, the effects on daily life may be something that patients need to manage on a day-to-day basis. Next question. What is the difference between small cell and non-small cell lung cancer? So non-small cell lung cancer is the most common type of lung cancer and accounts for about 80 to 85% of all lung cancers. We diagnose non-small cell lung cancer based on a biopsy. There are many different types of non-small cell lung cancer based on how it looks under a microscope and the results of a panel of genomic testing and an immune score. Small cell lung cancer is the less common type of lung cancer and occurs in about 10 to 15% of patients with lung cancer. And the incidence, number of patients affected by this, is decreasing with time. It is almost universally associated with smoking and tends to be a more clinically aggressive type of lung cancer. The next question. I quit smoking 15 years ago. What is my risk of developing lung cancer? This is a very important question. So while quitting smoking is the first very positive step anyone can take to improving their outcomes from lung cancer, even if the patient already has lung cancer, we know quitting smoking can help them by reducing the rate of complications, pneumonias, other things that can happen during cancer treatment. So quitting smoking is always right. Having said that, it is often the duration of smoking that matters in terms of the risk for the development of subsequent lung cancer. So if a patient has smoked for many years, even if they may have quit smoking 15 years ago, there may still be a risk for the development of lung cancer. Anyone who has smoked more than 100 cigarettes in their lifetime is defined as someone who has smoked in their lives and for whom smoking is a risk factor for the development of lung cancer. Last two questions. Are lung cancer survival rates improving? Thankfully, the answer is a resounding yes. We know that globally, the incidence and outcomes from cancer are improving, and this is nearly solely related to improvements in the diagnosis and treatment of patients with lung cancer. We have seen approvals in more than 20 different therapies for lung cancer, spanning targeted therapy that tries to pinpoint certain features of a patient's tumor, and immunotherapy that tries to use the body's immune system to fight lung cancer. Long may it continue. How can I reduce my risk? The most important thing that you can do is to stop smoking if you have smoked before. The second is to maintain a good general sense of health. And if you are someone who has developed the symptoms of lung cancer, to seek advice and an appointment from your general practitioner as soon as possible. Again, the symptoms of lung cancer: cough, shortness of breath, weight loss, coughing up of blood, and chest pain. Thank you.